Hey everybody, I'm Liam Bowler and Dynamic Alignment Bodywork, we're sort of synonymous, and right now in Missoula, Montana in a temporary office here, and I'll be largely out of Seattle actually this fall. If you haven't read that, you're welcome to check out my blog and kind of read up about that. But today I want to do a bit of a follow-up video to actually the very first video I made, which has had way more YouTube activity than any of the others, about nerve entrapment in the heel and the foot. And this whole video series was spawned by a question of a client. And this video I want to talk more about like lower leg stuff, so shin splints, plantar fasciitis, to name a couple. There could be a lot of different like names for soft tissue dysfunctions, or depending on where it is. And by dysfunction, really even more simple than that is being held in certain places and probably more moving more or overused and irritated in other places. So how to get that nice balance, which can tend to clear up a lot of like pain symptoms and motor, what we think of as like motor skill problems. So I've done the video about the nerve entrapment, healing up, freeing up the nerves around the heel, and I'll post a link to that if you haven't seen that, or you can just Google it. And got a reply, and have actually, this is certainly a common theme in my clinic, as you might imagine, asking about shin splints. And I think this is good stuff to know, because I remember before I got into this field, if I heard about shin splints, it would just be like, painful shins from like running or something, and maybe you can run less or stretch more. And what I've found is that, yeah, stretch more can be getting closer to the ballpark, but it can depend a lot on like what and how you're stretching. And that's maybe the same reason that like yoga, something like a good yoga practice isn't just stretching, that it's like a real engagement of certain lines and like releasing of others, and it can look really similar to a yoga practice that's not as helpful. But it's kind of the devil's in the details, as they say, or in this case the really good stuff is in the details. So two things, I'll cover two things you can do as like a self-treatment for especially, again, kind of lower leg ankle dysfunction. And first we'll get into the anatomy of it a little bit. And that is the one thing I want to mention, in addition to having, rather than have a skeleton with the leg bone and the ankle bones, which is cool, right? We have the ankle as a very it's a multi-jointed, what we think of as one joint, and you can know, but you just look down at your foot. It goes up and down to the side. And to allow that to happen, there's a lever and pulley thing going on, as we might imagine. The muscle contracts and then moves the bones around. And there's this thing happening just like in that video with the nerve tissue on the heel of shearing layers. And there's some really interesting imaging, if you are able to see an image of someone walking on a treadmill, where it's not like the calf muscle of the gastrocnemius and the soleus are two of the names. They're not even pulling uniformly. They're sort of gliding past each other, even within a single muscle. So in a lot of ways, that model doesn't really make sense anymore. And I think of just like there's sort of layers within layers, right? Even down to the nerves being able to glide a little bit. And then this more sort of big muscle shearing, gliding, things being able to squish and move past each other. So when I'm doing that motion with my hand, I'm talking about my calf, right? This stuff all being able to move not just as one unit, but as units within units within units. A lot of times, if one of those, and almost always the deeper layers, get sort of stuck and frozen in a position, I often use the word trance. They sort of get entranced in like a hook. They don't move very much.